Welcome to this podcast on nursing at Queen's University. During this podcast, you'll hear from current nursing students at Queen's University Belfast, and we'll be discussing what life is like as a nursing student at QUB. But before we begin, let's take a moment to get to know a little bit about our speakers. Amy, tell me a little bit about yourself.
So my name's Amy and I am studying children and young people's nursing at Queen's University, and I'm only 18, so I just came out of school fresh onto the course, and I decided to do nursing because of my own personal experience in the hospital with children nurses looking after me. So I just thought that it is actually my dream job to give back and make an impact on children like the nurses made on me.
Brilliant, Amy, thank you. What about Laura?
Hi, my name is Laura and I'm currently studying Children and Young People's Nursing at Queen's University Belfast. After having previously studied the Access course at Lisburn College, which gave me the grades to get into Queen's University.
Thanks, Laura. Hi, Olivia, do you want to tell us a little bit about yourself?
Hi guys, thanks Lisa. My name's Olivia. I am studying adult nursing at Queen's. I'm in second year at the moment, and I've come to nursing. Really, it's what I've wanted to do my whole life, and it's a bit of a dream job.
Thanks, Olivia. Katrina, would you like to introduce yourself?
Yeah, hi, my name is Katrina and I am currently studying learning disability nursing. I'm a mature student and a mum of 3 boys, and I decided to do nursing after completing a degree with the Open University in Health Science and felt that nursing would suit me better.
Brilliant, Katrina, thank you. And then on to Claire.
Thanks, Lisa. Yes, my name is Claire and I'm studying learning disability nursing, just like Katrina. And I have to say, this is my dream job. I was a youth worker for the past 10 years and decided for a career change. And I think this has been one of the best decisions I have made to decide to do this nursing degree at Queen's.
Thank you, guys. It's so nice to hear everybody's varied experiences. And something I found in nursing is just the variety of age range and circumstances in the course. And my name's Lisa, and I'm studying children and young people's nursing. I'm currently in second year, and I'll just be your host for this podcast today. So before we talk about life at Queen's University Belfast, perhaps you could tell me something about the different fields of nursing and what each nurse does. So I'll maybe start with Olivia, studying adult nursing.
So I suppose to just sort of give a broad sense of really what is a nurse, to me the most important thing about nursing is that you're an advocate for your patients, and I sort of think if you stand by that, you can't really go too far wrong, because everything you do, if you're really advocating for your patient at all times, like everything you really do kind of flows from that. So as a nurse, you're advocating for patients who maybe can't speak for themselves, or who maybe have issues with health literacy, or they maybe just feel a bit nervous. So that's a really big thing, is standing up for them. But then obviously you are a health provider, so you're providing care, whether that's medication or dressings or whatever it is, you're providing care to a person at potentially the most vulnerable time of their life. And I just think it's really amazing that we get to be a part of that time in their life, and I think it's a personal privilege to be able to make possibly those worst days just a little bit better. So to me, I think that's what a nurse is. Obviously it's such a huge role, and we could talk about it all day, but I think those are the most important points in my opinion.
Thank you, Olivia. And Laura, have you had similar experiences?
Hi, I'm just going to follow on from Olivia. Yes, being a nurse is very broad, but most importantly, I feel you're a caregiver to your patients. I feel that's very important to being a nurse, and holistically, you're providing care to the patient at their most vulnerable time. I also feel you're being a leader. You're providing and leading the care for that patient, enabling that patient to get better and to aid their recovery, really. I also feel a bit like what Olivia said, like being an advocate, but you're also a health promoter. You're promoting the health and the well-being of the patients. You're also preventing deterioration in a variety of ways through your care that you're providing. And you're also, most importantly, promoting the recovery of the patient.
Brilliant, Laura, thanks. I think you've both really captured the broad spectrum of roles of a nurse. What are some of the skills required as a nurse?
I think all of us can say that we have had someone who has looked after us, whether that is a nurse or in a different setting. And we all know that someone who's looking after us needs to be caring and compassionate. So a nurse would need that skill to be care and compassionate and kind. I know when I started in Queen's, there were some of the skills that I didn't think I had, but actually Queen's have supported me to develop the skills and to help me to see the skills that I had within myself that I didn't even recognise. We need leadership skills, organisational skills, communicational skills. In my first placement, I didn't do anything medical based on my nursing, but actually the communicational skills that I developed there were incredible, and something that I didn't even see was something that was that important. But actually all of the skills that we need, we are given opportunities to learn in them and to grow. So yeah, there is a lot of skills that you probably have within yourself that you don't realise you have, but there are people there to support you and to try and encourage you. And as a learning disability, I'll just swag into that. As a learning disability nurse, I remember when I started, I didn't even really know what that would look like, but it is helping us to support people with learning disabilities to achieve their optimum level of health and well-being. In my first placement, my supervisor said to me she wanted everyone to have their best day. And I think by being a registered nurse in learning disabilities, it's giving people the opportunity to have their best day. And I didn't really know where we could work as a learning disability nurse. But actually there are so many different areas that we can work: hospitals, nursing, residential cares, prisons, schools, working in different mental health organisations as well. And it is such an eye-opener to see where you can be. And I know that when I started it, I saw that there is a little gap in the market about Makaton, and uni have really helped me to be innovative and to just develop that as well, to develop my Makaton skills and try to help other people within my course and other professionals to learn Makaton as well, to help us to communicate with everybody. It's called Makaton Mondays if you want to look it up online. But yeah, they're the things that I have noticed so far.
Yeah, Claire, I was a bit like yourself. I wasn't sure where learning disability nursing would take me, but even at the minute, I'm on placement in a children's ward, and the nurses there have actually been saying that it's refreshing to have a learning disability nurse there, because they find that we are very good at communicating, and that also that we have been trying to encourage the families of the children to be involved in the care more, which is what we would do as a learning disability nurse. I find personally as a learning disability nurse, it's just tailoring the care for somebody with a learning disability. There's no difference in caring for them. It's just making sure that their extra needs are included and promoted and recognised, and that their families and carers also are able to cope with that and understand how to care for them.
That's great, Claire and Trina. Thank you so much. It was so informative. Learned about the role of a learning disability nurse, and I love that quote you said about you want everyone to have their best day. And I suppose as nurses, we're seeing people sometimes in very difficult situations, and if we can just make that as easy as possible for them, or as just by showing them some kindness and care, I just love that. Thank you so much. And maybe Olivia could tell us a little bit about the role of an adult nurse.
Yeah, before I do, I was actually really interested there in what Claire was talking about. Claire, would you mind explaining a wee bit about what Makaton actually is?
Yes, of course. Thanks, Olivia. So Makaton is use of non-verbal and verbal communication. So it is kind of like sign language, but you also are speaking to maybe someone who is non-verbal. For example, something that is very important in nursing is to say, hello, my name is. And it's by doing signs with that as well, so that the young person, adult, child, whoever it may be, who is non-verbal, they're able to communicate back with you. So they're able to do the signs for hello, my name is. It's just really important that we are teaching these children, young people and adults, we are teaching them these signs to use in hospitals. So it's so important for us as their healthcare providers to actually be able to sign back to them and understand them, so that they feel safe and loved.
Thanks, Claire. I think that's so interesting. That's fantastic that you're doing that work to make people feel so included in their own care. So yeah, as an adult nursing student myself, I have found that it is, as the girls were saying about learning disability, it's hugely varied, and I don't honestly think that I had any idea how varied it truly was before I actually came into Queen's to study adult nursing. I think sometimes when you think about adult nursing, you maybe think about just care of the older person, and that is a really important aspect and a really important sector of adult nursing, but it is a very small part of actually what you can be involved in. And I think for me, one of the really fantastic things about adult nursing is the wide range of opportunities you can have. So as an adult nurse, you can work throughout the kind of care spectrum. So you can work in primary care, you can work maybe in like a treatment room or with a GP, or you can work in a hospital, you can work in the community. There's just so many areas. So my first placement actually was in a care home, and similar to Claire, actually I didn't have a huge amount of medical practice in that placement, but it was so hugely beneficial. I was working alongside dementia patients, and I truly believe that the experiences I had there have made me a better person and will make me an entirely better nurse. And one of the great things about the course at Queen's as an adult nurse is that you have some out of field placements as well. So I had a placement in health visiting where I was working alongside a health visitor, and we were looking after children and babies in the community, and that was really interesting for me as an adult nurse to get that perspective. And again, I had a placement in a psychiatric ward, so working in mental health, and again, like, I really did find that hugely beneficial, because everyone that you care for, whether you're caring for them because they need a surgery or because they've had an accident or whatever's wrong with them, that person still has mental health, and to be able to care for that person holistically is really important. So sorry if I've rambled on a little bit there. But yeah, I think it really is such a varied career being an adult nurse. And there's just so many opportunities for professional development and leading care. And yeah, I'm really excited about about being an adult nurse.
That's great, Olivia. Thanks. It's good to hear about the course being so varied and all the different opportunities you're getting. I think one thing that struck me is how sometimes the fields overlap. So like as an adult nurse, you could be caring for somebody that has mental health issues or a learning disability. I find as a children and young people's nurse that I've been caring for children with a learning disability. So it's good to have those different experiences, isn't it? As I said, I'm studying children and young people's nursing, and really the main role of a children's nurse would be to care and advocate for children from premature babies right through to young people up to the age of 18 and into early adulthood. And I think that's important just to note that some people just think it is all young children, but you are caring for children right up to the age of 18, and then dealing with their families as well, because children are part of a family, and often if children in hospital, the parents are staying with them. So you have the opportunity to work with a family too, and I've loved that. I've really enjoyed the variety of that. Maybe, Laura, you could tell me a little bit about where does a children's nurse work, and what sort of areas?
Thanks, Lisa. Yeah, a children's nurse works as part of a supportive and inspiring team. They provide children and young people and their families, which is important too, with the vital care and compassion they need. Children's nurses, I have found, it's very specific, but it's also very varied. It has great opportunities that you can have. A children's nurse can work in hospitals, community settings. There's also places like the Children's Hospice that is available for qualified children's nurses. Actually, my previous job before starting uni was a special needs school, and we in the school had a children's nurse as well. There's also opportunities to go into specialist nursing within children's and GP practices. Similar to Olivia, I find with the children's course in uni, we had an out of field placement in our year, and ours was learning disability, and I found that very, very beneficial. It was just great to experience the out of fields, but as you said, Lisa, they are also very, very linked.
Thanks, Laura. And what about Amy? How have you found life as a children and young people's nursing student?
I have absolutely loved children's nursing so far. My first placement, I was with the school nursing team and then got to do a bit of health visiting, and I'm currently on my out of field placement, which is adult learning disability, which going into, I went in not expecting it to be anything that it was, but it has been so useful, and like you really do see the links within it. Obviously every child can have a learning disability, any child can have a mental health issue, and seeing that, and even on my first placement, making the link has been really, really useful. Children's nursing is really challenging, that's what I would say, and you do have to make sacrifices, but it is the most rewarding thing, just getting to provide care for children and their families.
Thanks so much, everybody, for sharing those experiences. So interesting to hear from the different fields of nursing. So maybe we'll just go on to think a little bit more about what life is like at university. Amy, do you want to tell us a little bit about that?
So nursing at Queen's is a 3-year full-time course. So you really do have to dedicate at least Monday to Friday, 9 to 5. When you're on placement, your placement can be at the weekends too, and they can be 12-hour shifts, 8 to 8, and they can also be night shifts. At nursing at Queen's, you will gain 2 qualifications. So you get a degree, but you also become a registered nurse. You get a bursary from the Department of Health, and it puts you through the course, so they pay for the course, and then you get your bursary, which is for what you work on placement. For the government, it normally costs around 30,000 to put people through uni. Obviously, if you go to mainland, like tuition fees are really expensive, so it really is a privilege that you're getting put through the course. And I found the bursary really useful as a school leaver, because as an 18-year-old, I did not have a lot of savings, so it really does come in useful. QUB offers for the 4 fields of nursing, which is adult, children's, mental health and learning disability.
I find personally with the bursary, you do get a personal allowance, but as a parent, you can be entitled to a little bit extra for each of your children or your partner, but a lot of people aren't actually entitled to that. It depends on your previous earnings, and it can be quite difficult. I found as a mature student that I would have to be very prepared and organised and do a lot of budgeting. There's no more luxuries at the minute, but it's a sacrifice that's going to be worth it. It really is going to be worth it. So it doesn't annoy me that much, I have to say, but you just need to be ready for that especially too, childcare isn't fully covered with the bursary. You will get a little bit of allowance for childcare, but you won't get as much money as you might expect. And a lot of people find that a bit of a challenge. So you do really need to be prepared for what could happen with childcare.
That's great. It's good to hear the pros and cons. It's brilliant to get your fees paid. That's great. We'll just go and talk a little bit about the programme then. So as you've heard already, 50% of the time is theory in university, and then 50% of the time is practice in a variety of clinical environments. So that'll be your placements throughout Northern Ireland. So roughly runs in 6 weeks. It's not tied to 6 weeks, but roughly it's 6 weeks in university, your academic learning, and then 6 weeks on placement. So you have roughly 3 placements a year, and we're told before we start that the placements can be anywhere throughout Northern Ireland. And I suppose as I was heading into it as a mature student with 3 children, I thought, okay, that's the worst case scenario, So if my very first placement then, I'm from Bangor and I got a placement in Newry. So it was a wee bit of a challenge just to get used to that. But I suppose what I would say is to be prepared for that. Be prepared that you might have to travel and have things in place, childcare and people can help you out during that time. And always remember, it's usually only 6 weeks. So to me, that's how I've coped with university life as a mature student, is just getting through every 6 weeks, and it is manageable. And looking back at the placements, my placements have been so varied that I've been thankful then for the different opportunities. I've had a placement in the community and a placement in hospital and learning disability placement, and they've been really useful, and emergency department as well. So it's been so useful having the variety, and even if you have to travel a little bit further, even think of it as a learning opportunity if you can, that although it's difficult, you're getting to see another trust area, how things are done in that trust, maybe even a different way of life. The placement I had to travel to was turned out to be quite a rural placement, and I just found it interesting to see and useful to see just different settings. Just be aware that you could be asked to go anywhere in Northern Ireland, and don't let it come to too big of a surprise for you. Patrina, you had a similar experience, didn't you?
Yes. Both my placements have been about 45 minutes to an hour drive away. I think that shocked me the most. I had assumed I would get a local hospital, and actually at the minute I'm driving past the local hospital to go on to the placement. So But you get used to it. As I say, I'm up most mornings for placement at 5 o'clock, and I'm not home till after 9. And then by the time you get washed and you get the children's lunches sorted, you're like, dear Chris, I have to go back in tomorrow again. But you're right, Lisa. It's just seeing it as it's only 6 weeks. It's 6 weeks out of my life to kind of get this done, and it's worth it. I find with the journeying is what I now do. I use that time to kind of process what has happened in placement. So I kind of use that as a pro to having that long journey time, whereas if I had been beside, I would have went home and thought about placement too much, I think.
Yeah, that's right, Trina. I found the drive useful for that as well. And I don't really want to tell my family this, but I actually stayed away the odd wee night and it was like a wee break from But yeah, Amy, you had a different experience, didn't you? You were a school leaver and you came to live in Belfast. How did you find placements?
Yeah, so I decided to get accommodation in Belfast, which comes in useful for being close to Queen's for classes, but you are not guaranteed to get your placement in Belfast. So I actually, for both my placement when I moved back home, I'm from Portadown, and I still had to travel 30 to 45 minutes for both my placements, and that was from home. So if I was going from Belfast, it would have been even longer. So you really do just have to make that sacrifice if you're deciding to get accommodation. But I would not change where I've got my placements. Like, I've been so thankful for them and completely agree with everything you said, Lisa. Another thing with my first placement in school nursing and health visiting, you have to drive to the schools and you have to drive to the different houses yourself or get your own travel. And that's definitely something that I didn't think would happen, but I wouldn't change them for the world. I've loved every second of my placement, but yeah, just definitely be aware that you're not guaranteed to just get placement 15 minutes from your house, or you're not guaranteed to get it in Belfast if you get accommodation. Like, you have to be willing to make the sacrifice.
Well, that's great. It's good to hear everybody's experiences, but just to hear how positive those were as well, as maybe the difficulties with travelling, but just that it's worth it. So we're going to go on and talk about the different intakes with nursing. There's an intake in September and February. So I'm going to ask maybe two students who have had a September and a February intake to talk us through those. So maybe Olivia and Claire.
Yeah, thanks, Lisa. So I'm a February intake student in adult nursing, like I said before, and so I think like the February intake, to be honest with you, I didn't apply for it. I applied for September and I was offered February because the course is obviously always oversubscribed. And to be honest, at first I was a wee bit disappointed, and I was like, oh, I'm going to be on a different schedule to my friends and won't have as much time off in summer and stuff. And there are definitely things to think about. Like, you will be on a totally different schedule if you're someone. So I came pretty much straight from school as well. So a lot of my friends are at uni at the moment, and so I am on quite like a different schedule to them. I don't really have time off in the summer, which is when obviously they would be going on holidays and things. But there's also huge benefits. I know a lot of the girls in my course who are mums actually really find the February intake works out a little bit better for them. And I know a lot of people really like the February intake because it's a lot smaller than the September group. So you do find you make more friends, I think, because we're all quite close, even though a lot of classes have been online and things. You do find that you can sort of connect with more people because it's a smaller group, and it really feels like everyone's very supportive of each other. So that's like a huge benefit, I would say, to the February intake. And something I actually really love as well is you get your kind of extended time off around Christmas, and I love Christmas, so it's actually really nice to have a wee bit of time off then as opposed to the summer. And do you know what, like, if this is something you really want to do, and like I was saying, for me, this is literally all I've ever wanted to do, and I could never see myself doing anything else, you're really just doing the course because you want to be a nurse. And so whether you have to start it in September or February, for the vast majority of people, they really don't mind, because you make your friends in your own group, and you just sort of get on with it. But yeah, I would definitely say, like, consider that that there are definitely, you know, pros and cons like to the February intake, but overall for the vast majority of students, I would say that the February intake has been a hugely positive experience so far.
Yeah, I'm February too, Olivia, and I love being off when everybody else isn't, and not having to go out in those dark mornings. There is some benefit.
Yeah, it's great.
And Claire, how are you finding the September intake?
Yeah, so I am September and I have really enjoyed it so far. So I think it felt like a natural start. With school year starting in September, it just felt that it was great. As I said before, I had left my job to do the degree, so it just felt like a very natural end to the job to then go into this degree and for a new start. And also stationery sales are always happening in September, so that is always such a bonus to walk past and get a new notebook or two. But both are amazing, like Olivia said. Like in both September and February, you're learning the same things. It's the same course, you're getting the same qualifications. But how amazing is it that there's a degree that is so oversubscribed that there's 2 intakes? It shows you how valuable Queen's thinks this degree is, and actually how much they care about the nurses that are coming through. And I think just what Olivia said, like you're in, if you get in September or February, like you're in, and that's all that matters. So many people would love to be in your position, whether you're in February or whether you're in September. So amazing that you have got that far. So for me, September is great, but February would have been just as great as well.
Yeah, I totally agree, Claire. The one of the things as well I think that's really interesting about the different intakes is the kind of mix of people that you have. So I think the September intake is for adult nursing, learning disability, and children and young people's nursing, and then February is for adult nursing, mental health nursing, and children and young people's. And I actually really like that as well, because for a lot of the smaller classes you'll be with your own field of nursing, but for some bigger classes you'll be with, maybe for me, I'm with some mental health students, some children's nursing students. So it's really interesting to kind of chat and get the different perspectives from each other as well.
Yeah, I was surprised when I got February intake, but I was just so pleased to get a place on the course that it really didn't matter. That's the same course whether you start in September or February, and it's such a privilege to get one of those slots. So so we'll move on just to think, what's life like at university as a student? Have you had an opportunity to be involved in anything in university life?
Yeah, for me, I've really enjoyed university so far. I think like with a lot of our classes having been online for the last year or so, I think something that's been really important for me is putting myself out there to get involved in different things. And obviously that's quite a privileged position to be in, that I have that time, and because I don't have kids to look after or anything. But for people who do have the time and stuff to be able to put yourself out there, whether your classes are online or in person, it's a really great way to like make new friends and to really develop your sort of professionalism as well, because you can be involved in a number of different things throughout the School of Nursing and Midwifery. So like for example, all of us, are involved in this podcast, which is really fantastic. And I myself am a peer mentor and a class rep. So as a peer mentor, you basically are like support for new first year students. So they can come to you with questions, and you can kind of provide them a wee bit of support that is a wee bit more informal, I suppose, than them having to go to a lecturer every time they have a concern or anything like that. And as a class rep, I sort of like represent my little tutorial group to the rest of the year and the rest of my cohort, and then also to the rest of the school at what are called student voice committee meetings, which is also a really like great way to develop skills of leadership and stuff, which are so hugely beneficial in nursing. And I think as well, then kind of outside of nursing, I'm involved in like some sports. I play hockey and I go to the Christian Union at Queen's, and there's just putting yourself out there and kind of can be a wee bit scary at first, but whenever you do kind of go to these different things, you meet such fantastic people, and you really like broaden your horizons, so I think like those are the things that have really made my university experience.
Yeah, I completely agree with you there, Olivia. I find it's the additional things that have made my experience too. Like I'm also class rep and absolutely love that role. I'm also involved in the school's education committee. It's meant for Queen staff, but they have invited a few students to give their opinions, and I find it really beneficial for saying how us students actually feel about what is happening in the course. And along with that, we've did other things, like myself and Claire here. We were part of an online resource to promote resilience in students. I found that brilliant, and have actually been telling everybody about how good this is going to be. That we've been part of creating this resource for Queens. And also another thing, with a brilliant crack there on Twitter over Dragon's Den. We all had to come up with an idea, an innovative idea, and a few of us that have made the final have been bantering with each other about who's going to win, and it'd be brilliant because it really does help you get involved with other classes that you mightn't see, because it is online at times. You don't see other nursing students, so things like that there really do help you engage better.
Yeah, just to say, like, to add on to Patrina's with the Dragon's Den, my group's definitely going to win. But anyway, I think actually within Queen's, it gives you the opportunity to be you. And if you see a need, they give you the platform to fill that need. So they really are all about the students and helping the students to develop things in practice that would make things easier as nurses and for the people who we are going to look after. I think it's so important that they, if they see that you have a strength in something, they encourage you in that, and they ensure that you are able to do what you can with that gift that you have or with that skill that you have. So I just think it is just such a great place as a student to go to, because you are able to be innovative. And the Dragon's Den stuff really was good. They're trying to help us all to build links within our cohort, which is great.
Oh, that's brilliant, guys. It was good to hear, because obviously we've been talking about the academic side and the placements far away, but it's good to hear even you talking about things that had a bit of crack and a bit of fun, and you need that time too, don't you, when the course is so full on. So that was great. I think one of the things I've really enjoyed about life at uni is the modes of learning, because academic work can be very full on and heavy at times, and I just really appreciate it. There's different modes of learning, from workshops, tutorials, lectures, podcasts. You could even go out for a walk and stick on a podcast and listen to that. And I find that really helpful as my learning. So I really appreciate it, those different modes of learning.
Yeah, I find Queen's really tailor the learning to suit different people's study type. Like I love the podcast myself. I would be more into that type of learning, but for other people, they love watching videos. There's plenty of videos, the tutorials where you can discuss. That's actually brilliant too. So it is that you're in smaller groups and can discuss ideas, or you can actually say, you know what, I actually didn't understand what was said in that lecture. Could you explain it a bit further? I find that the amount of different types of learning is fantastic in Queen's.
Brilliant. And what's life like then on placement?
Lisa, I'll answer that one for you. I feel with my own experience so far within the uni course, there's so many great learning opportunities on placement. I feel with my own placement, like I have met so amazing people, they're all the staff on the trust that you work with, they're willing to help you and they want you to learn, It's important to remember when you're on placement, like you're upholding your professionalism at all times, you have to remember that you're working as a member of the trust, and that's very important. But there's great support while out on placement.
Yeah, I personally just finished 2 night shifts. I spent the weekend there doing night shifts. So when you're on placement, it can be any time and of any day of the week. But it doesn't matter if it is night shift. I found the learning there was brilliant. You get time with your practice supervisors and practice assessors to say what you would like to learn, which is fantastic. Plus, if you are feeling overwhelmed, like my latest placement, I had never been on a ward before, and the first week I just felt like a fish out of water, and I went and spoke and says, you know what, I actually don't know what I'm doing here, can you go through it all? And they were brilliant. They just says, right, we'll go back to basics with you and we'll start. And this week I'm a completely different person. They've even said to me, wow, look at the change in you. But it's all because I was willing to say to them, like, I'm finding this difficult.
Yeah, that's right. Trina, I think it's important to remember too that as well as working those 37.5 hours a week, every week you're in placement, you usually get allocated a supervisor and an assessor, and you'll just work whatever shifts they are, whether it's night shifts, day shifts, but you're 37.5 hours a week. And I think what surprised me as well as those full-time hours, at the same time you could have an assignment on the go, or you're working on your portfolio as well, which takes a good bit of time. So like I find as a as a mum of 3 on placement, that I didn't really have any time outside of placement and my home commitments, to take on any other work or anything like that. So it's just to be prepared, isn't it, although I love placement, it's to be prepared for the huge commitment of it.
Yeah, I work part-time in a care home and have actually changed my contract to relief because they have been asking me to work. I can't work in this placement. I need time to myself. I can't, so I've just changed my shifts.
I've found for me it's been amazing actually to get different opportunities in learning. So I've just had my out of field. Well, I'm currently in my out of field placement and I'm in a children's hospital, and I have absolutely loved that. My first placement, I was in an adult day care centre for adults with a learning disability. It was incredible. I just keep thinking it can't get any better. But every time I go on placement, I'm learning new things, learning from different staff members, and actually just seeing the importance that every staff member has in a team. So it has just been amazing. Life on placement is full on. So like Patrina said, and Lisa, there is no time for anything else. If it's important to you, you'll make it your priority, which has been great. But yeah, you will learn so much on placement, and it is just such a brilliant opportunity to be able to do that.
Yeah, I love what you were saying there, Claire, about placements giving you the opportunity to learn from so many different people. Like, that's one of the things, to be honest, that I've loved most about placement is when you're in uni, you're being taught by nurses and you're being taught about nursing. But when you're out on placement, you also have the huge benefit of being able to learn from doctors, occupational therapists, speech and language. You get to work alongside physios, you get to work alongside, nurse specialists in certain areas. You learn from so many different people, and it's amazing getting to learn from the nurses. But I think that the other people you work with have such a huge benefit as well and can teach you so much. Even the likes of the healthcare assistants just spend so much time with patients. They can really teach you so much about like personal care and communication, and I really do think that's, for me, has been one of the huge benefits of placement. Like you have all said, it's a huge balance, and like it is a wee bit mental sometimes. I'm sure we can all agree, but no, I really do think for me that's been one of the highlights of placement, is being able to learn from that, what we call the multidisciplinary team, or the MDT. Has been so helpful.
Yeah, I agree with everything else the girls have said too, and I've loved every second of my placements so far, and I think it's so good that we actually get the opportunity to, like, I was sent my first placement after being at Queen's for 5 weeks, and it is quite daunting and nerve-wracking, but the fact that we get the opportunity and that learning opportunity to go out there, like most courses at uni, you wouldn't get a placement year until your 4th year. But the fact that we just get to go out straight away, and you're essentially doing what you joined the course to do. Like, you're getting to go out and you're getting to shadow another nurse and see what a nurse does and work as part of the team, and it literally just is the best experience ever, and you learn so much from it.
That's brilliant. Thanks so much. It was great hearing your experiences of placement, and that there were positive experiences, as well as just highlighting that full-time commitment. And I suppose when we're talking about nursing and about the full-time commitment and about the intensity of placement, it's important to note that there's support out there for you. In university, you'll have your personal tutor that'll be assigned to your own small class, and you'll have that person for the 3 years of your course, and that can really be your first port of call if you're having any difficulties, and there's just a good encouragement too. There's a year lead that'll keep you right and keep you on track as you go through, and there's just good support out there, whether it's academic learning, support in the library, and then on placements, you have you're assigned a practice supervisor and an assessor, and those I found in placements, like, they really want you to do well, like they've been really invested in you, and I found that a real privilege just to be working alongside them. You'll also have a link person in Queen's while you're in placement you can get in touch with, so I have found there's good support. And I know we're talking about you need to give it your full commitment, and you need to be at class, available Monday to Friday 9 to 5, but I think it's important to note that if situations come up, that there is support there. Laura, you had a situation through the year, didn't you, where you had to get a little bit of support from the university?
Hi, Lisa. Yeah, unfortunately, I had a family emergency throughout my year of the degree, but I have to honestly say the support that was given to me by all the lecturers that I was in contact with regarding the emergency, and at the time I needed to take off university and placement, it was just amazing. The support was very overwhelming, and I will always be very thankful for the support, and thanks to the lecturers and their support and help, I was able to get back to uni and get caught up with all the work and finish the year.
Brilliant, Laura, thanks for that. So maybe we'll round up with just one final question. Have you enjoyed the programme so far? And one piece of advice for someone wanting to undertake nursing?
I've absolutely loved doing nursing at Queen's so far. And I think if it's something that you're thinking about doing, 100% go for it. If you feel like nursing is the job that you want to impact others' lives and you want to help make a difference, I say go for it. And the one piece of advice that I would give, whether you're starting nursing or you're just thinking about doing it, is something that was mentioned the very first week when I started. We were told to always remember why we started. So obviously nursing, it is challenging. Nobody can deny it. But always just remember, like, you decided to do nursing, you applied to nursing, you're thinking about doing nursing for a reason, whether it's something that's happened in your life or you just want to help others, you're starting it for a reason. So no matter how challenging it gets, just always remember how worth it will be, that it is essentially what you want to do.
I love that, Amy. I think that's like one of the things that keeps me going sometimes on like the hard days, is remembering why I've started. That's such a good piece of advice. I've loved the course as well, to be honest. Like, you know, people do say, and I think someone said it earlier, I've loved every second, and I won't lie to you and say I have loved every second, because like Amy said, it is really hard sometimes, and you really do have to be committed. But I have overall like really enjoyed the course, and I really couldn't see myself doing anything else. So I would say, like, my one piece of advice, if I had to say to somebody starting off in a career in nursing, would be, you know, you can only do what you can do, and it's a really difficult job, because sometimes, a lot of the time, it's hard to separate what you deal with on placement and at work from your personal life, and it's really hard sometimes to kind of switch off, and you can be really affected sometimes by the people that you care for, but just know that you are doing your best, and that's all that anyone can ask. And that goes for your academic work, but that goes really hugely as well for the people that you care for. They appreciate what you do for them, and you really can only do so much for someone. So just know that whatever you are doing is good enough. I would say that would be something I would really want to say to people.
Yeah, I have absolutely loved every minute of my experience. I actually feel so privileged to be here and to get the opportunity to do nursing, especially now. Like, I'm a mature student. I don't want to say my age, but I do. I feel so privileged that I'm getting this chance. And my one bit of advice is just milk every opportunity, both with Queen's and out in practice. I have just said yes to so many things that I mightn't have said yes to before. I probably wouldn't have. I find it has really, really boosted my confidence. It has just made me love the course. It's just been a wonderful time. It really is worth it, even though sometimes I do have hard days with having 3 children. And you know what? It's at the end of the day, it's the nursing that's been keeping me going and making life worthwhile at the minute, to be honest with you.
Yeah, I've really enjoyed the course. It is hard, like all of us have said, but I have really enjoyed it. And my one piece of advice is get yourself organised, get yourself that notebook and write down your lists, put your timetable into your phone or your diary, whatever it is, and give yourself the best chance you can. Don't let yourself slide down, just get yourself the best chance you can. And there's so much support out there from Queen's, so if you need help, reach out for it. It is all there, ready to be used. So if you need the help, ask someone.
Just like everyone else, I've also absolutely loved the course so far. As a mature student as well, I feel very lucky and fortunate to actually be a student of Queen's University Belfast. If I was to give one piece of advice, I find just work at your own pace. Like, sometimes I remember when I first started, our class sort of group chat was just going constantly, and it made me feel a wee bit overwhelmed at times, thinking, oh, I haven't got this done, am I not doing that right, because everyone else is talking about it. But I just learned that if I do my own work at my own pace, it suits my style of learning, well, then you will get through it.
Thanks. And I've loved the course too. I first applied for nursing more than 20 years ago, and I didn't get in at that stage, and life just sort of took over, and I always dreamt about going back to it. So my friends keep me go on saying, so you're actually living your dream now. And I keep saying that, well, not every day feels like that, but I do. I'm really feel privileged to be in the course now and to have the time to commit to studying something that I've really wanted to do. So I'm really, really enjoying the course, and I'm enjoying life at Queen's. My one bit of advice would be just make sure you're ready for that full-time commitment before you start. And for me, it seemed like a long road ahead because I had to do the access course first. But just take every stage at a time. You know, I just think get through this 6 weeks or this year, you know, and don't look at the whole 3 years, you know, and terrify yourself. So, but I've found it a real privilege. Thank you for taking the time to listen to this podcast, and I hope you found it useful. We also hope that after listening, you are now excited to join the programme. Thank you again to my colleagues Olivia, Katrina, Laura, Claire and Amy. And on behalf of us all, thank you and goodbye.
Bye.
Bye.
Bye.